Welcome to this pharmacology quiz on cephalosporins, part of our continuing pharmacology quiz series. In this video, we will review key cephalosporin drugs which are commonly used in managing conditions such as pneumonia, urinary tract infections, skin and soft tissue infections, and bacterial meningitis. This quiz contains 10 recall-type multiple-choice questions designed to test your core pharmacology knowledge. Each question includes 5 options, followed by the correct answer and a brief explanation. The video will pause after each question to give you a few seconds to attempt the answer before the correct option is revealed. So, let's get right into it. Question 1. Which mechanism of action best describes how cephalosporins exert their bactericidal effect? Option A. They inhibit bacterial protein synthesis at 30S ribosome. Option B. They block DNA gyrase and prevent replication. Option C. They inhibit transpeptidase enzymes and cell wall synthesis. Option D. They inhibit folate synthesis via dihydrooctoroate synthase. Option E. They increase membrane permeability by binding ergosterol. The correct answer is Option C. They inhibit transpeptidase enzymes and cell wall synthesis. This is because cephalosporins are beta-lactam antibiotics that block penicillin-binding proteins, preventing cross-linking of peptidoglycan and causing bacterial cell death. All other options describe mechanisms of different antimicrobial classes such as aminoglycosides, fluoroquinolones, sulfonamides, or antifungals. Question 2. Which of the following statements about cephalosporin generations is incorrect? Option A. First-generation drugs are the strongest against gram-positive cocci. Option B. Third-generation agents have enhanced gram-negative coverage. Option C. Fourth-generation drugs are strong against both gram-positive and gram-negative. Option D. Fifth-generation agents active against MRSA. Option E. Second-generation agents lack gram-negative activity. The correct answer is Option E. Second-generation agents lack gram-negative activity. The explanation is that second-generation cephalosporins actually have improved gram-negative coverage compared with first-generation drugs. All the other options correctly describe the typical spectrum progression across cephalosporin generations. Question 3. Which single sentence correctly describes the pharmacokinetics of cephalosporins? Option A. Most cephalosporins extensively metabolized by liver. Option B. They are primarily eliminated unchanged in urine. Option C. They accumulate mainly in adipose tissue. Option D. They are inactivated by gastric acid. Option E. They are predominantly excreted in bile. The correct answer is Option B. They are primarily eliminated unchanged in urine. This occurs because most cephalosporins are renally excreted in active form, requiring dose adjustment in renal impairment. All other options are incorrect because hepatic metabolism, fat accumulation, gastric acid destruction, or biliary excretion are not the main elimination pathways for most cephalosporins. Question 4. Which of the following drugs is most appropriate for treatment of Pseudomonas aeruginosa infections? Option A. Cefazolin. Option B. Cefuroxime. Option C. Ceftriaxone. Option D. Ceftazidime. Option E. Cephalexin. The correct answer is Option D. Ceftazidime. The reason is that ceftazidime is a third-generation cephalosporin with specific activity against Pseudomonas aeruginosa. All other options lack reliable antipseudomonal coverage and are mainly used for other bacterial spectra. Question 5. Which single sentence about ceftriaxone is correct? Option A. Requires dose adjustment in mild renal impairment. Option B. Eliminated mainly through biliary excretion. Option C. No activity against gram-negative bacteria. Option D. Must always be given orally. Option E. Cannot penetrate cerebrospinal fluid. The correct answer is Option B. Eliminated mainly through biliary excretion. This is because ceftriaxone has dual elimination but is largely excreted via bile, allowing use without major renal dose adjustment. All other options are incorrect as ceftriaxone has gram-negative activity, is given parenterally, penetrates CSF, and usually does not need adjustment in mild renal impairment. Question 6. Which of the following statements about adverse effects of cephalosporins is true? Option A. Commonly cause irreversible nephrotoxicity. Option B. Frequently produce severe ototoxicity. Option C. May cause hypersensitivity similar to penicillins. Option D. Cause universal cross-reactivity with sulfonamides. Option E. Invariably cause bone marrow suppression. The correct answer is option C. May cause hypersensitivity similar to penicillins. This is because cephalosporins share the beta-lactam structure and may produce allergic reactions in patients sensitive to penicillins. All other options describe adverse effects that are either rare, exaggerated, or unrelated to cephalosporin pharmacology. Question 7. Which drug is preferred for treatment of MRSA among cephalosporins? Option A. Cefepime. Option B. Cefazolin. Option C. Ceftaroline. Option D. Cefuroxime. Option E. Cephalexin. The correct answer is option C. Ceftaroline. This is because ceftaroline is a fifth-generation cephalosporin with activity against methicillin-resistant Staphylococcus aureus. All other options are earlier-generation cephalosporins that lack reliable MRSA coverage. Question 8. Which drug is most suitable for community-acquired pneumonia comparing cephalosporin with macrolide? Option A. Azithromycin. Option B. Clarithromycin. Option C. Ceftriaxone. Option D. Erythromycin. Option E. Roxithromycin. The correct answer is option C. Ceftriaxone. This is because ceftriaxone is a third-generation cephalosporin commonly used for typical bacterial community-acquired pneumonia. All other options are macrolides, not cephalosporins, and therefore do not meet the comparison requirement. Question 9. Which single sentence correctly compares cephalosporins and penicillins? Option A. Cephalosporins inhibit bacterial DNA replication. Option B. Cephalosporins bacteriostatic, penicillins bactericidal. Option C. Cephalosporins share beta-lactam ring with penicillins. Option D. Cephalosporins lack gram-positive activity. Option E. Cephalosporins only effective against anaerobes. The correct answer is option C. Cephalosporins share beta-lactam ring with penicillins. The explanation is that both classes contain a beta-lactam ring and inhibit bacterial cell wall synthesis by binding penicillin-binding proteins. All other options incorrectly describe their mechanism, activity, or spectrum. Question 10. Regarding drug interactions and safety, which statement is correct except? Option A. Can increase bleeding risk with anticoagulants. Option B. May cause disulfiram-like reactions with alcohol. Option C. Always require hepatic dose adjustment. Option D. Can reduce vitamin K synthesis. Option E. May interact with nephrotoxic drugs. The correct answer is option C. Always require hepatic dose adjustment. This is because most cephalosporins are renally excreted and do not routinely require hepatic dose adjustment. All other options describe recognized interactions or safety considerations associated with certain cephalosporins. The quiz is now complete, and thank you for taking part in this cephalosporin challenge. Don't forget to drop your score in the comments so I can see how you performed. For deeper revision, consult Katsung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, which also aligns with the guideline references used in this video. These resources will help reinforce the key mechanisms, spectra, and clinical applications you have just reviewed. Subscribe for more focused pharmacology quizzes and high-yield learning content.